Where are we with funding reform in New South Wales, in your opinion?
Well, the first phase of funding reform has been bedded down in the last financial year. We're now moving into the next phase, which involves two things. First of all, introducing funding for mental health and non-admitted patient services. And secondly, getting our system more familiar with actually using activity-based management. It's more than just activity-based funding. It's how we manage our services with the same level of transparency that the new framework presents.
So there seems to be a drive to move service closer to people, into the community. How does activity-based funding help that?
So one of the great things about the framework that's been set up under the new arrangements is that people can actually get paid for services that step outside the hospital, where we're actually providing care that avoids hospitalisation or substitutes for it. We can actually attract funding for that. Indeed, one of the big drivers in New South Wales is moving out of hospital care and delivering really integrated care with our primary care partners.
We know what the costs are for a hospital admission, but we don't really know what the costs are to keep that person out of hospital. So on the Central Coast, we're doing a lot of work around our community-based services, understanding what we do, who we do it to, and what the outcomes are, and just as importantly is what the cost is, so we can make informed decisions about whether we admit someone into hospital or what the alternative is, so that we can make a decision not only what's best for the quality of the patient care, but also on the price. And if there is a variation, and the assumption is there is a variation, we know we can take that variation and invest in more community-based care.
So you've done a lot of work in the area. What were the hurdles you found when you wanted to move people into the community?
Look, I think there's an assumption that it's very easy to do and that it's cheaper and it's well coordinated. And whilst a lot of the services are coordinated very well at a general practice level, there's still a lot of work to do between that interface between general practice, primary care, and in fact the LHDs. And whilst we've done it very well on the Central Coast for 12 years or more, there's still a lot of work we've got to do, particularly around, for me it's about having an underlying business model and a sustainable model where you can move people and patients around between the different providers so that it's seamless to the patient, but the GP knows what's going on, the community nurse what's going on, the private physio knows what's going on, and we can all share the same information.